How do we improve healthcare together? 2014 was an exciting and rewarding year for eClinicalWorks. We've expanded upon the definition of healthcare, providing tools to improve access to quality, affordable care that makes delivery of care safe, measurable, and effective. We've also helped doctors realize a positive return on their investment and improve the overall health of our patients. eClinicalWorks now provides a unique health record to over 200 million patients, supplying technology that is always on and always available when and where you need it. One key component of our technology is the kiosk. The tool is a smart and efficient way to streamline the patient check-in process. We spoke to Cambridge Pediatrics about how the kiosk has helped revolutionize their practice.
Cambridge Pediatrics, a premier patient and family-centered pediatric medical home in Southern Maryland, is dedicated to caring for their patients and their families. To supply those patients with the highest quality of healthcare, Cambridge Pediatrics is focused on the use of technology to improve patient-physician interactions. Adopting eClinicalWorks EHR allowed the practice to become more efficient and improve patient engagement. Further, the eClinicalWorks kiosk app for iPad allows staff to streamline the check-in process, freeing the front office to better assist patients, answer phone calls, and take care of referrals and other ancillary services.
In 1993, we split, and the parent portion of the adult portion of the practice was sold to a different provider. The pediatricians in the group took over the pediatric office. At that time in the adult office we had NextGen. I really prefer eClinicalWorks to NextGen. It's a lot more pediatric friendly. NextGen was great for adults but didn't really have any of the features that we needed for pediatrics.
So let's talk a little bit now about the kiosks. The kiosks are relatively new to our practice. We started with 2, we're already up to 4. And space providing, we might even get more. So why do we like the kiosks here at Cambridge Pediatrics? A couple of things. One, the patients get more privacy because no one is asking them questions out loud. We've actually put little screens between them so that they have utmost privacy. Patients can fill out things at their own speed.
I love the patient campaigns. They are just so wonderful. They actually call our patients for us if they don't show for their appointments. They call our patients for us if they didn't go for their referral. The system calls the patients if they didn't go for their lab work that they were supposed to have done. And that's saving on staff. You know, the cost for your staff, the time that it takes to do it. I mean, you're actually having a tremendous savings from that, as well as providing better care.
It's just great in all aspects, as far as paying your payments, signing in, checking in, and not waiting in line, because it's just, life is just so hectic right now, and time is like the key. No one wants to wait anymore. People want to get in and out. So I've seen from my experience, just getting in and out is just so much easier. It's just great. I couldn't tell you anything else, nothing bad about it. It's just great,
We are happy to hear how the kiosk has assisted Cambridge Pediatrics in bettering the workflow of its practice for its patients. Similar to the kiosk, many practices have also begun utilizing eClinicalTouch. We sat down with Dodge City Medical to discuss the benefits of eClinicalTouch and how it's improved their practice. eClinicalTouch uses standard iPad gestures such as tapping and swiping to help complete tasks quickly and efficiently. The practice is able to annotate and ink documents with ease right on their iPads.
Dodge City Medical is a multi-specialty practice located in Dodge City, Kansas. After implementing eClinicalWorks and seeing the advantages from their EHR, they took their practice a step further and implemented eClinicalTouch. Using eClinicalTouch on the iPad became much easier and faster for the practice than on a laptop. And it's less intrusive during the patient visit, and patients love that the practice is using the most up-to-date technology.
I think it's been a great improvement in my workflow, and I'm glad to have it. It's nice to have that when they scan in the documents, it's all right here, and we don't have to go looking through a bunch of papers, and we can just look through in the document section and find everything that we need. And I do, the patient education and ordering the labs and x-ray, and it's been very beneficial.
The advantage is huge because before the iPad, everything was done by hand or by dictation. Once you go into this type of technology, I don't think there's any reverse. You'll stick with it.
We hope to see Dodge City Medical's continuous success with eClinicalTouch in the near future. Next, we'll sit down with Dr. Singh from Lenox Hill Hospital on how using eClinicalWorks has aided increase his patient population.
Over the coming year, you will see Hilo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Hilo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Hilo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Hilo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Hilo. Find more information at my.eClinicalWorks.com.
Since implementation, Lenox Hill Hospital has utilized eClinicalWorks in order to improve its practice's workflows significantly. So far, its patient population has more than doubled in size. The system has given patients around-the-clock access to their medical information from the comfort and privacy of their own homes. eClinicalWorks has also encouraged patients to be proactive in the management of their own health care with access to Patient Portal.
Hi, I'm Dr. Rick Singh. I'm a family practice physician in the southwest suburb of Chicago. Our medical practice group has been on eClinical. We went live in 2009. Prior to that, I was employed by the hospital and we were on MISIS. My introduction to eClinicalWorks was I was so frustrated with MISIS because it was rate limiting how many patients I could see. I wanted to be the rate limiting step and not my EMR. I'm a huge enthusiastic supporter of integrating technology into practice of medicine. Our patients have been very, very pleased. We've actually quadrupled our practice size since going live on eClinicalWorks, and I do believe eClinicalWorks had a part to do with that. Our patients are very, very happy with the fact that we provide patient safety, quality care for them, and integrated that into medicine. To kind of illustrate that point, I have an example of one of my patients who's been a long-time patient. He actually travels quite extensively domestically as well as internationally for his employment. He has a history significant for asthma. He was actually coming home on a flight from a long business trip. On that trip, he realized that he didn't have any of his inhalers, and he was starting to have some mild difficulty and acute exacerbation of his asthma. He did realize that he was on a plane that had Wi-Fi, so he quickly connected, went on Hilo, and actually contacted myself. I received his web message, was able to see he was in some distraught. I was able to locate a local pharmacy near O'Hare Airport, and I called in all of his medications and refills for him. About an hour later, I did receive a message from the patient stating that he landed safely. He went to the pharmacy. All his medications were there waiting for him. He used all of them. He was actually feeling much, much better. That he would follow up with me in 1 to 2 days for evaluation. And he had two comments. One was he couldn't believe how incredibly fast we were responsive to his acute distress that he was having on the airplane. And secondly, he was very impressed with the way we integrated and infused technology into medical practice for his quality of care. So I sent them a message back stating that eClinicalWorks is flying into the future, and it's because of it that we were able to provide such rapid and quality care.
That was a great story Dr. Singh shared with us about how eClinicalWorks Patient Portal can provide patients with urgent care. Next, we spoke to Dr. Jeffrey Kramer about how he utilizes eClinicalWorks Scribe to generate accurate and comprehensive progress notes on the spot using dictation. Scribe will allow you to use voice-based commands to complete many documentation tasks within eClinicalWorks, eClinicalTouch, and eClinicalMobile.
We visited Jeffrey Kramer, a neurologist from Mercy Hospital in the Chicago area, to discuss how he utilizes eClinicalWorks Scribe. With no prior knowledge of using Dragon dictation, he found that the program was very easy to become accustomed to, and now thoroughly enjoys having it in his practice.
Prior to having eClinicalWorks, I did not have an EMR, but in my hospital work here at Mercy Hospital, I did use Dragon dictation for certain consultations, though somewhat briefly. When I first got eClinical, I went on the website, did the video training for Scribe. There were, I don't know, 8 or 9 different features, 1, 2, 3, 4 minute video clips. I found them to be helpful. Then I started using it. After 3 months or so, I went back to see what I could add or what I was missing, and enhance my workflow even more. What I found impressive about using Scribe is that it allows me to perform the same amount of dictation consultation as I had in the past with an outside dictation service in an easier, simpler fashion. And then when I see a follow-up patient, I just edit the last progress note. My initial note comes back, and I'm sitting with the patient, talking to the patient, and directly with the computer at my side, and I'm able to edit that progress note with the updated information. My workflow is much more efficient, it's simpler, and when it's all said and done, I think that my notes meet all requirements.
Using dictation, you can improve your practice immensely and practically eliminate any transcription costs. In our next segment, we'll be speaking with Dr. Biggs from Amarillo Medical Specialists on how his ACO has improved using eClinicalWorks CCMR. eClinicalWorks Continuity of Care Medical Record, or CCMR, is a single vendor solution with integrated analytics and care coordination together in a single unified platform, supporting ACO, PCMH, home health, and shared savings initiatives. Dr. Biggs from Amarillo Medical Specialists shares with us how CCMR has helped improve his practice.
We spoke with Dr. William C. Biggs, an endocrinologist with Amarillo Medical Specialists and CEO and Medical Director for Amarillo Legacy Medical ACO, and listened as he explained how eClinicalWorks was able to create a more organized environment and better communication with the doctors within the organization.
We want the patients to look at their physicians as their primary contact or entry point for any kind of medical issues that come up, so that they'll go through the primary care doctors first rather than self-referring or going to the emergency room. So by doing that, we're being able to reduce the emergency room utilization and drive more patients into accessing their doctors in the office, or at least if they can't do that, using one of the urgent care centers that we're allied with in our ACO. So having the EHX platform reporting back to a common database so that we could look at incidents of care no matter where a patient was very useful. Being able to get all of the ACO quality measures reported to a common place. There are a lot of insights that you can obtain from careful analysis of your data, but one of the beauties of this whole project is that we get not only the claims data, which insurance companies have had for years, but we also have the EHR data at the same time. And that synthesis of having the actual patient data and claims data together is extremely powerful. But also it gives us some new insights as far as who's likely to need care, identifying the people that we need to reach out to with our care managers and intervene before they get sick or before they need to go back to the hospital or emergency room. All those things are extremely powerful as far as improving people's health. and keeping them out of the hospital, which is an expensive place to be. For our Medicare contract for the year 2013, we saved almost $5 million for Medicare, and that's with about 10,500 patients roughly. So that was a significant savings compared to previous years. All the doctors feel like, oh, I'm immunizing everybody, and then when we show them their actual data and how they rank, within our system, that's very useful to them. They realize, well, gosh, maybe I'm letting more people slip through than I thought. I need to re-examine what the process is like in my office and how I can improve that. So it's allowed our doctors to improve in ways that you would have never imagined before. We started for year 2012 a hospitalization rate of 323 per 1,000, and our last quarter, our hospitalization rate had fallen to 248 per 1,000, which is an enormous drop in less than a year and a half. So we can see the measures working. We can see that patient satisfaction is there, that patients actually are able to sense that something is going on, that they really can't put their finger on it, but they know that their doctors are working better together. There seems to be better communication between the doctors and the patients and the doctors and each other. So the system is working, and this is making medicine a more fun thing to do. That we've had problems in medicine that it's been a stressful occupation, and making it kind of fun and exciting again is a great thing.
Organizations utilizing the various functions within eClinicalWorks have seen significant improvements across the board. We hope you enjoyed listening to this edition of eCW Podcast on how real eClinicalWorks customers explain how they use the system and why they enjoy using it. If you have any questions or would like to leverage some of the functionality you've seen in this show, please email us at podcasts@eClinicalWorks.com. Also, check us out on YouTube, keyword eClinicalWorks, and our podcast is also available on iTunes. I'm Aaron Ibrahimi from eClinicalWorks. Thanks for tuning in.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.